A hospital is probably one of the most dangerous places to go because the worst illnesses end up at the hospital. So infection prevention and control is a specialty of public health. So to be honest with you, when you have these outbreaks, they are probably the best capable of dealing with these things. Well, how we work, right, is that we don't establish infrastructure wherever there's a problem in that way. How we work, health is a network of infrastructure, and you move people where the need is. Man level has an issue. It's not, the issue in man level is not just the high occupancy level. The issue in man level is that we have had a cluster of cases in the hospital involving clinicians, with nurses and maybe a doctor or two. And I think the last number I saw was like 20 or something like that. So something happened there, where we had a cluster, an outbreak. When we have these things, we plan for them. So there is a protocol. We pull back, we extract the people who are affected, we do some quick contact tracing and some deep cleaning, and then we try to resume normality as quick as possible. And based on what I've gotten from Mandeville and the region there, southern region, they are working on solving the problem. We routinely test infirmaries, the institutions, the prisons, communities. So depending on where the positive cases turn up at our health facilities, our team assesses it, and then we deploy the mobile units or otherwise to go into those communities. Our surveillance efforts has been, to my mind, one of the big successes of this COVID response. At no point are we caught totally off guard, because they observe trends and they deploy based on those trends. Our epidemiologists, the team, they have worked really well, and in fact, I think that's one of the strengths when compared to other countries. One of the reasons why we took the decision that we took to reduce increase the curfew was that way, is because it has been used most effectively in the past when we have had issues to control spread. And the ultimate worry, in a sense, is not just about how many people get COVID, because I think we're long established that a lot of people will get COVID. The real worry is hospitalization, and of course the ultimate worry is death. And what we don't want is people needing hospitalization and we can't provide for them. I am at this stage now as minister where I have never been more concerned about our capacity to respond. At 88%, and with the trend going where it is, the truth is we would become overwhelmed in a relatively short space of time if we don't cut back on the hospitalization. So while we manage and try to bring the vaccines, people have to recognize that we can't get complacent and we have to deal with putting in the capacity. So this ward is going to be a welcome addition, the additional space next door, the one in Trelawney, and the field hospital, which we received that generous offer from the US, will become very important. But while we do that, we still have to manage to make sure that we don't go too much further than where we are. If you add the 36 in Palma, where I go tomorrow, and this 50 something here, you add another 100, so it would be, we have about a 30% increase, 25 to 30% increase in 25% increase in overall COVID deaths, which is like good timing, because I suspect that we will have exhausted the 50%. If we continue on this rate over the next 2 weeks, we're going to run out of space under the current arrangement.
When is this going to be operational?
Well, the PS has said that they want to put in the furniture late on weekend. As I think that, right? Yes. So what is that? So what about personnel? There's one thing to put in infrastructure. What about the people?
Well, we would have plenty requests for additional employment, but in the interim we will mobilize and move around what we have to accommodate.